The National Disaster System, many of you do not know, it's been in operation for over 15 years. It was actually started around 1985, 1990. One thing I really need to say to you here is that if we ever have a disaster in the state of Oregon, many, or if not most of you in this room will be intimately involved in the disaster. And that's why I'm actually speaking to you today, because there is a community call for action, and I will highlight those issues in my talk. One of the other areas of uniqueness in Hurricane Katrina, it was the first time in the history of modern United States that the entire municipality was affected, essentially evacuated. It was the first time in the history of medicine, modern medicine in the United States, that the military was called for the evacuation. This is what we call the NDMS medical system. The military, in that design, was to provide patient movement to the disaster area, utilize all sorts of transportation, and primarily relies on aeromedical resources of the military as well. Could I have the next slide, please? You can sort of see on the slide that, frankly, most of us in the civilian world do not actually work with the military, but the National Disaster Medical teams do. This slide actually points out the following things. The question was, why did not the citizens of New Orleans evacuate for Katrina? This illustrates essentially what happened. What happened was the levees broke on both sides and allowed floodwaters to basically breach the city and flood the entire city. What I really am pointing to is that talking to the responders and people inside New Orleans, there was no early warning to the citizens of New Orleans that this was breached. This next slide actually illustrates the timeline. There is a misstated concept that all portions of the government didn't work. That's not quite true. We were activated on Saturday, and NDMS activates 9 Type 1 team and 9 strike teams, as well as corresponding what we call urban search and rescue teams. This was actually on Saturday before CNN, ABC News, and all the national news actually paid attention to this. We were actually moving. So this essentially is 1/3 of the entire NDMS operation. The plug was pulled on Saturday by NDMS and the USAR operations as well. Next slide, please. On Sunday, unbeknownst to a lot of different people, Hurricane Katrina was now Category 5. The mayor finally got convinced to call for a mandatory evacuation, but unfortunately, at this period of time, it was evacuation not out of New Orleans, but to the Superdome. On Monday, Hurricane Katrina hits the coast of New Orleans as Category 4. NDMS attempts to send the medical team into the Superdome, and most importantly, on Monday morning, roughly around 9 o'clock New Orleans time, the levees break. The EOC, which was right next to the convention center, was made aware of the levees being broken on Monday morning. For many different reasons, many citizens in the city of New Orleans were not aware of this break. The baby here, next slide please, is being taken off one of the internets in the interstates as well. Next slide. People were stranded on the rooftops. Next slide. And the elderly and disabled were being evacuated. Next slide. There was a significant, quote unquote, makeshift evacuation by people with boats as well as refrigerators. Next slide. And essentially on the timeline, the NDMS sends teams to the airport, which was our operation. Next slide. Late Tuesday, the teams were at the airport. There was only 6 teams, and just to let everybody know, each team was capable of taking care of approximately 100 people. Unbeknownst to a lot of individuals, a lot of the nursing homes, as well as some of the hospitals, were not able to evacuate. So many hospital staff were stranded without food, as well as many New Orleans nursing homes did not evacuate to the airport. Next slide. You can sort of see civil unrest that occurred, and this actually really stranded a lot of the evacuation efforts and frustrated many of the rescuers as well. Next slide. On Wednesday, our team traveled to Houston, arriving in Houston at 10:30 p.m., and we drove from Houston to Baton Rouge. We were in communication with our other team members who were already in the airport. They indicated that they were out of medications, out of food, out of water, and basically have no rest. So we arrived on Thursday afternoon at approximately 13:30 hours. Next slide. And on September 1st, we actually prepared and arrived with the U.S. Air Force EMED, U.S. Service Type 1 Overhead Team, and U.S. Protective Service. Next slide. During this period of time, the citizens of New Orleans were in anguish. They were stranded, they were without food, they were without water, they were without facilities as well. Next slide. You can see the chaos occurring in the street. Next slide. And on September 1st, the hospitals, including Charity Hospital, arrived with busloads of patients. And on September 1st, first 4 days of the mission, we struggled to deliver care, and we saw up to 3,000 patients. Keep in mind that each of these teams were only supposed to see 100 patients per day. So we actually had 10 times the amount of patients that we actually had and drilled for. We were, frankly, overwhelmed. Next slide. On September 1st, evacuation of New Orleans continued, and the evacuees, up to 10 to 15,000 of those individuals, were stranded at the airport without food, without water, without sanitation. There was chaos in the terminal. There were assaults, there were rapes, and a lot of sundry things I can't speak of right now. Next slide. On September 5th through 10th, air evacuations improved. We got help from the U.S. Forest Service and select volunteers. Next slide. September 5th through 10th, Louisiana EMS arrives. We have 4 additional DMAT, and the evacuation finishes. Next slide. The total patients that we evacuated were 3,000. We probably saw about 6,000, and there were total evacuees were 20,000 to 30,000 at the airport. Next slide. Many of the patients were ventilator dependents, and frankly, we did not have enough ventilators. Next slide. Many of the patients were nursing home patients. We frankly did not have enough patients to perform patient care, nor did we have any records of the patients themselves. Next slide. The patients were out of medications, and there were many patients requiring specialty care, including hemodialysis. I've been in emergency response, medical emergency response for 25 years. I have never seen the size and scope and magnitude of this operation. The airport was chaos. There was multiple people on the ground in the terminal, the upstairs and downstairs terminal. Next slide. Volunteers. Next slide. Litter patients waiting to be taken to the airport. Patients with pets who refuse to go without moving their pets. Next slide. And chaos outside the terminal. So, in the last 2 or 3 minutes, I'm going to summarize, can a disaster hit our community? You bet. You can sort of see the disaster-prone areas. Interesting enough, the Pacific Northwest is not on there. But as everybody knows, there can be a disaster in our community. Earthquake, next slide, is a significant area where we need to concentrate our preparations for. Next slide. Tsunami on the Oregon coast. I read the press as well, and there's a lot of work to be done with the early warning system on the coast. Next slide. As well as an item that's near and dear to our hearts, the pandemic influenza. Next slide. So, the last 4 or 5 slides will go into what we need to do. The assumptions. Response to disasters are always a local event. This is how it's supposed to happen. If there is no local to, obviously, be advocates, the disaster will not go well. Next slide. Second one, this is the most important and the topic appropriate to our discussion for Dr. King's legacy. Relationships need to be developed before the disaster, not after the disaster. Disaster planning needs to be taken seriously by the community and the agency responding. Everybody that's in emergency response knows what I'm talking about. When we drill and when we train for keeps. We do not play. We did not make things up. We drill exactly the way it's supposed to happen. If you actually look at Katrina, this may have not have happened. Next slide. The communities must be completely engaged in the collaborative relationships with elected officials and local disaster responders prior to the disaster. Next slide. Relationships between government emergency teams and local communities need to be developed prior to disaster. And this is, next slide. This is what should have happened the first day after the hurricane. This did not happen until 2 weeks after the hurricane. Next slide. Second thing, the government disaster response, myself included, we need to be acutely aware of the ethnically diverse nature of the population and be much more sensitive to the needs of the victims of disaster. Okay? I can't tell you that telling someone or a community what to do versus really developing working relationships are two different things. What the community hears versus what they know are two different things, and it's up to us in public service to make that happen. It's not up to the community. Next slide. We need, as emergency service personnel and everybody here, to reach all the population, especially at higher risk. It's okay to be sitting in a suburb with everybody with a TV and says, well, it's on CNN. Everybody knew about the hurricane. There were people there that didn't have a TV, didn't have a place to stay, didn't have anything, and they didn't know about the hurricane. Okay, so it is not acceptable for us in the public service area to make sure that this does not happen. We need to let the entire population know what is the message. Next slide. Elected officials need to be briefed on their roles before the disaster occurs. So they know what they need to do, how to do it, when to do it, and where to do it. Next slide. Evacuation, if needed, needs to come early in an orderly fashion. Next slide. And finally, I'd like to end on the responsibility of the individuals. I'm going to stop for 20 seconds here. How many have a disaster plan? Could you raise your hand? How many actually have a disaster kit in your home? Raise your hand. How many actually can know how to contact your loved ones in case of disaster? Raise your hand. Okay. So those are the things that actually I need to make a very good point. We as emergency responders and the community need to take care of our loved ones. We cannot respond if our loved ones are in jeopardy. So we need to actually take a time to actually think about those things as well. You need to discuss with your family, places to meet, how would you communicate, establish an out-of-state contact, and develop a plan as well as taking care of your pets, and develop a family disaster kit. Next slide. Next slide. And that's it. Okay, so in summary, I would like to give you a challenge. In the setting of community action as Dr. King, we need to actually get together, and the time is now as a community. We need to talk with each other. We need to talk to each other about the issues, and we need to understand each other. And Dr. King's legacy actually gives us a great opportunity to do this as well. Thank you very much.